As we continue our Tick Week series of reports, we are taking a closer look at the only FDA-approved laboratory test for Lyme disease and the co-infections that could make it even worse.
There is a blood test that detects antibodies we produce in response to the disease, but sometimes the test can miss the presence of Lyme in its early stages when treatment can be most effective.
Right now, there is a bill making its way through the legislature that would give doctors more clinical test data to help stop the disease in its tracks. Here's News Center Maine's Vivian Lee.
Now, in most cases, a blood test for Lyme just states positive or negative. There's no other information. This session, lawmakers are considering a bill that would require those labs in Maine to provide more clinical data so patients don't fall through the cracks when it comes to getting early treatment. Amy McDonald was a highly successful real estate agent when she began to experience health problems, including vision issues and a loss of feeling in her body. She did take 3 different tests for Lyme. All came back negative. Meanwhile, her symptoms got worse.
I lost the feeling in the entire right side of my body, and they were trying to figure out what was going on. So I had MRIs, CAT scans, I had a lumbar puncture.
After 3 years of suffering, Amy got a more comprehensive test which showed there were positive markers for Lyme, but it didn't meet the CDC's requirement for a positive test. The result, along with her symptoms, though finally led to a diagnosis of Lyme.
My youngest daughter doesn't even remember what it was like before I got sick. All of this is preventable for other Mainers if doctors are simply given the raw data from labs that they're already producing during testing.
Amy and a number of patients are pushing for a bill LD 906. The proposal would ensure physicians receive full diagnostic test data concerning tick-borne diseases. Supporters say that information is needed to make sure patients get early antibiotic treatment within 3 to 4 weeks of infection. Aaron Bolster testified before the legislature's Health and Human Services Committee that his daughter Logan had to drop out of Husson College after experiencing chronic pain, lethargy, and depression. After testing negative for Lyme 3 different times, she underwent colonoscopies and other procedures she didn't need at all, trying to find answers.
Not only did it take, an immense amount of time to define the Lyme disease, but it was expensive. Out-of-pocket expenses for my family and I exceed $25,000 to date.
After a number of negative tests, John Cole was misdiagnosed for years and suffered from neurological problems to swollen joints.
Had I been able to get those results earlier, I could have started antibiotics therapy earlier.
But unfortunately, nobody's changed those criteria since the 80s, and labs these days are still using those criteria that were never made for real-world medicine. Appreciate that. All right, thanks.
Dr. Sean McCloy is an MD at Integrative Health Center of Maine. He has treated Lyme patients for almost 2 decades. The CDC has recommended 2-step antibody testing for Lyme disease and other co-infections. The first test is called the ELISA test, which looks for antibodies against Lyme. If it's positive, another test that looks for more specific antibodies, called the Western blot, is performed. Because it can take weeks or even longer for the body to create a detectable immune response, Dr. McCloy says standardized tests can often miss more than 1/3 of cases.
The problem with that Western blot is that other infections can also cause some of those bands or antibodies to be positive, and that oftentimes you don't get the number of bands that you would want to see in Lyme disease for that test to definitely be positive.
Dr. McCloy uses out-of-state labs that relay more comprehensive data, and he supports providing the full diagnostic data on test results, especially for providers who may be reluctant to diagnose patients without a positive test.
But at least by getting the information, they can educate themselves and learn how to read those Western blots to a greater degree of detail, and then help their patients make a better decision.
News Center Maine reached out to a number of labs operating in Maine, including Nordics Diagnostic Laboratories and LabCorp, about the bill. We did not get a response from LabCorp. Nordex is a member of Maine Health's integrated health system. A Maine Health spokesperson tells News Center Maine in a statement, quote, "While the specifics of this bill are still being worked out, Maine Health has serious concerns about any attempt to legislate medicine.
Tick-borne disease story.
As for Amy, after undergoing treatment, she was able to resume her real estate career, and she often speaks publicly about the dangers of Lyme disease.
I am making improvements, but the damage that was done is hard to repair.
Now, new tests for Lyme disease are currently being developed, but the FDA will have to approve them first before the CDC makes any recommendations. As for the bill in the Maine legislature, if it fails, patients tell us they'll push for federal legislation to ensure that this critical data is available to both providers and patients. For Tick Week, Vivian Lee, News Center, Maine.